So with that, we thought it'd be kind of fun to do a startup-related panel. So I'm going to actually introduce Frank Jaskulke, and he'll be moderating this panel. So I'll let him introduce the speakers.
Thank you, Adam. Good evening, everyone, and thank you all for coming out tonight and spending your evening with so many other smart people working to save lives. I appreciate you taking the time. We're going to have a fun and rather informal discussion now about what's going on in the community, and I just want to say clearly, when we use the word medtech, we mean that truly as medical-related technology. For us, it encompasses everything, whether it's device, diagnostic, digital, or drug. It's all the stuff you're working on. And so I'd like to ask our panelists to come up now. Russ, Dave, James, Dan. Yep, there, and there we go. I was looking for if you guys want to just come up, grab a seat, grab a mic. Then make sure your mic is working. All right. Gentlemen, I appreciate you coming up and being under the HD spotlight. So we're going to have a discussion. We'll try to keep it very informal. And I want to start just with the basic one, the one I hope you guys can't get wrong today, which is starting from one end to the other. Just a quick introduction. Who are you? What do you do? And what's your involvement in the entrepreneurial community here? And so maybe Russ, if you'd like to start.
Okay, very good. Good evening, good afternoon. Russ Strati. I work in the tech transfer office here. I run the Venture Center, which is part of the University of Minnesota.
Thank you for hosting us.
Yeah, oh, you're welcome. And so our team's job is to help create startup companies that come out of the University of Minnesota. And of course, life sciences and the work that's done in research in life sciences at the University of Minnesota is about 2/3 of our research budget. So as you might imagine, a lot of startups come out in that particular field. Prior to that, I was a co-founder of a medtech startup working on a portable hemodialysis system before I came to the University of Minnesota.
Yeah. Thank you. James?
Good evening. I'm James Kent. I'm the Chief Operating Officer of a local company called Focus Start. We seek to bring early stage devices mostly out of research universities, places like the University of Minnesota, and actually also from Mayo. Do the product development in-house, position them to be taken on by one of the larger players in town or one of the multinationals, and developed for commercialization somewhere else. Prior to that, I started a company developing soft tissue markers, radiographic implants, and sold that company to a strategic player about 8 years ago.
Thank you. Dave?
Thanks. First of all, thanks. I'm super excited to be here. My name's Dave Knapp. I'm the Vice President for Corporate Research at Boston Scientific. Located here in the Twin Cities. Been with Boston for 18 years in a lot of different roles. But my group is focused on is looking at kind of the front end. What's next for Boston Scientific? And we spend a lot of time in collaboration with both Mayo and the University of Minnesota, as well as a lot of the startups that are located in the Twin Cities. And so, we know that a lot, 99% of the innovation is outside of the walls of Boston Scientific. So we do a lot of collaboration from our group and across the company.
Thank you. Dan?
Good evening. My name is Dan Estes. I'm Vice Chair at Mayo Clinic's Department of Business Development, under which lies Mayo Clinic Ventures, the what you might call tech transfer arm of Mayo Clinic. I've been with Mayo for 13 years now, primarily in attending to licensing and operational roles for that business group. Prior to joining Mayo, I was 23 years in the manufacturing industry, not healthcare, but manufacturing nonetheless, so I know what it takes to bring a product to market, and certainly appreciate the opportunity to participate tonight.
Thank you, gentlemen. Dan, Russ, I want to start with you guys on a question, because you're both in a tech transfer role in a group that is helping to seed a lot of companies in the community lately, and I've kind of been thinking about this, call it like pre-gBETA, pre-generator, post-gBETA generator. It seems like for both organizations, the last number of years, the pace of new ventures coming out of each organization has both increased but also increased in local impact. Could I ask both of you just maybe to talk a little bit about the changes that have happened with the organizations that maybe have driven that? And are there any like brag points either organization could share about how much is coming out?
Yeah, so thanks, Frank. Yeah, so at Mayo Clinic, agree. The pace of innovation has continued to expand. Our group is the benefactors of tremendous amount of research and clinical activity going on. It's highly innovative at Mayo Clinic. They've been doing this. Our group's been active since the mid-1980s, and our activity level continues to grow year over year. A high amount of input from our clinical and research staff bringing us new ideas. And in addition, there's been some policy changes at Mayo. About 4 years ago, they made a policy change that allowed our staff members to engage in entrepreneurial activities and primarily be able to start medically related businesses and take roles as ownership. That prior to that policy change, that was not possible at Mayo Clinic. And that has spurred on some significant amounts of activity going on from our staff. And beyond that, the technologies that we have been very rich fodder, if you will, for starting up companies. So, you know, beyond tech transfer, we do startups as well, beyond just licensing technologies. So we're always active in taking on roles in entrepreneurial activities and startup companies. We've, over the years, I think Mayo Clinic Technology is, I think the number today is, I got 160 startups based around Mayo Clinic Technology. And that, you know, we'll do anywhere from 7 to 15 new companies a year. And I would say these are companies that have smart money behind them. So we've got a pretty high bar on what we do as a startup, outside of our entrepreneurial ones where our staff can take the technology and run with it. So, you know, the activity's been robust, and it's something we think we do quite well.
And it sounds like a concerted effort to increase that pace.
Yeah, there is. There's leadership at Mayo is interested in, quite frankly, broadening the base of businesses that reside in southeast Minnesota. You know, Mayo Clinic dominates the environment down in Rochester, and we'd like to expand that. And one of the best ways we think we can do it is to bring in new companies and spin off companies based on our technologies that bring in a vibrant workforce and offer a place not only for entrepreneurs to flourish, but for trailing spouses and other people that want to come live and work in Rochester to come and be a part of that community.
Yeah, fantastic. And then Russ, what about at the U?
Well, you know, a lot of the change started back in 2005 when the university looked at tech transfer at the University of Minnesota and said there's probably some opportunity here to do better. And pretty significant change out in the team. Jay Schrankler came in, took over the office, and brought in a lot of new people, including myself at that time. And subsequently, the number of disclosures in our office now has gone from around, we were doing about 180, and we're now doing about 400 invention disclosures a year out of the research year. Significant increase. And then we're converting those over to licensing to existing companies. And, you know, last year we launched 18 new companies out of the University of Minnesota. We're up now, since the Venture Center was formed back in 2006, late 2006, we're at about 130 companies, and they've raised in excess of about $400 million in private equity in the marketplace. And all but about 25 are still alive and kicking. So we have a good survival rate of companies out there to do. And so no, there's just there's a tremendous, there's a lot of really good things going on at the University of Minnesota, and you know, in the ecosystem here in the Twin Cities, at least from our perspective, we've seen that rise, that tide rise significantly. Our success is really built around, you know, partnering with the environment here, with the entrepreneurs and the investors and the companies that are involved in, and so activities like, you know, Boston stepping up and doing what they're doing, and you know, here with this accelerator, I mean, that's what it takes, and that's really what it's all about.
Yeah, so Dave, maybe talk about that. So what was the motivation for Boston Scientific to get plugged into this and to really, in a very concrete way, support the furtherance of, you know, I counted about 290 startups between Mayo and the U of M, maybe try and push us over that 300 number?
Yeah. So first of all, I think Jeff, you know, really teed that up. But, you know, what I would say is that, you know, what we realized was that, while the startup environment here is very healthy and, and flourishing, that we really had an opportunity. In my mind, there's a lot of basically sleeping potential here in addition to that to really amp that up. And so from my perspective, what can we do to help that? So we worked together with Jeff and my team to essentially partner with gener8tor to create this environment where we could essentially create a mentor network across just first-class clinical institutions, University of Minnesota, incredible technology here, and Mayo Clinic as well, in order to kind of bring, in what is a relatively condensed period of time, essentially 7 weeks, a ton of value to these companies. I think you're going to see that when they pitch here. And so we can bring them value in terms of accelerating their efforts. And really what I hope is that it will encourage others to take that step, to know that they can take the risk, that they have the support in the environment to really to take that risk and step forward. And from our perspective, it's hugely beneficial to be involved with these small companies early, so that we can understand what their needs are, how we can help, and we can understand how to move forward the innovation.
And I'm hearing this a lot in the comments so far, and the comments from the others that spoke, this notion that there's a lot of activity here, there are people taking risks, but we want to work on improving the environment to make it easier and more supportive. And James, you had jumped into entrepreneurship, jumped right into med device relatively early on. What could you maybe contrast when you started your tissue marker company and the environment you found then to what you're seeing now and what Focus Start is experiencing in the work that you guys are doing today?
Sure. I mean, looking back, wouldn't do it the same way probably, but I think that's, I probably, I hope I'm smarter and more knowledgeable about the process, but right. I had a passion for science, I always have, and for business as well. And I think an obsessive personality, which helps in that regard too. But I think the biggest differences I see are exposure. Events like this and organizations, Life Science Alley at the time was around, now Medical Alley again. And I think it's wonderful to be a part of that community and to be at as many events as you can be. But the exposure like this is new, at least it feels new to me. The opportunities to look at innovative ideas at the university and at Mayo, we have licenses from both, actually, so thank you.
That worked out.
Has gotten easier, and the portfolios are richer, and you kind of have the ability to be picky, and it's a lot of good to look through, so that makes it easier as well. But I think the entrepreneurial environment has never been better, frankly.
Very good. Maybe I'd ask you all to expand on that last comment about the things that are happening. And I would say this even from being somewhat of an outside observer, that it feels like more organizations are stepping up, making that commitment, not just to the industry, but to the community. Maybe looking forward 5 years from now, with all the stuff that's happening today, I'd ask each of you, where do you think we could be as a community? And is there a gap that yet exists that, we have all these people here today who can influence what goes on. What gap should we all as a community be working to fill to get us to that future state? Maybe Russ?
In the medical device or life science area, 5 years really isn't very long. I don't know that a lot's going to change too much in 5 years, but clearly healthcare IT continues to flourish, and there's a lot of good things going on. I think the Twin Cities has really done a nice job in the tech sector, healthcare IT sector, of building up a position in that particular sector with the skills and expertise. I think there's some issues maybe with some labor shortage in the programming side, and we got to work as institutions like university to crank out more students and find those students that can fill those jobs. But that's probably there's some other sectors that are we just did a little workshop here recently on neurostimulation or neuromodulation. We think that's That's going to be a hot area in the future. There's a lot of good research being done here in the university, I think, that can help stimulate some of that along. And then just worldwide, it's a really hot area for investors to look at, entrepreneurs to look at, and of course the strategics are seeing it as a new business line for them in the medtech area as well. You know, in the areas where I would say maybe a future positive, you know, we still are a little hampered, I'd say, and I know the good deals get funded, and that's true. The good deals get funded, but if it wasn't for the angel network here in the Twin Cities right now, it would be really, really tough for startups. You know, it's high net worth individuals, it's angel organizations like the Gopher Angels and Angel Pollination that have really stepped up and filled that early stage gap for funding. But what we lack today here, and it's not just the Twin Cities, it's in the Midwest in general, is that professional money that brings governance to boards of companies, that allows them to be led and connected to a lot more resources at the coast for money. That really is a gap that we have. I was in Michigan last week, and they have the same problem, and we've been talking about, you know, putting together some kind of a consortium for the Midwest, you know, institutions getting together like the University of Minnesota, University of Michigan, and trying to figure out what we can do to get more critical mass around drawing attention and pulling some of that money off the coast into the Midwest.
So I heard talent, capital, and then just diversifying the sectors. Cool. Yeah, James?
Just to piggyback on what Russ just said, I think finding new sources of capital, you know, the venture money in this town has largely left from in terms of medtech at least. And that void has to be filled. And hopefully organizations like this where you can form a pipeline and strengthen it from universities and research organizations to industry, that may help to fill that gap. I think 5 years from now, hopefully we'll be continuing on this pathway. I think we have an opportunity to mine the talent pool in this region, which is very deep, and spin out a lot of innovation in new companies and in new sectors, and taking learnings from you know, the payers. We have UHG in town, combining that with the ability to innovate new technology in neurostem or something else, and really make something world-changing.
Capital diversification. Heck yeah. Dave?
So, you know, maybe to touch on a slightly different point, you know, from Boston Scientific point of view or strategic point of view, I think that one thing I'm seeing is that over the last 5 years, we have really upped our investment in from our venture team. You know, we have a very robust venture fund, and that we a group that invests across, and so I think that's increasingly, you know, a player that has been important here locally as well as you know, around the world. And in addition to that, I think this idea of sort of almost like a brown bagging it from a collaboration perspective. We bring our best strengths, you know, to these collaborations, and we have very strong collaborations with everybody, I think, sitting here, whether it be through Focus Start or through University of Minnesota, and certainly Mayo for the last 6 or 7 years we've been doing this work, and it really does take understanding how you can bring your differentiated talent and skills to the table. And everybody, I think, brings a willingness to collaborate here in town, which is also shown through the excellent kind of IP arrangements and agreements that we can get through through all of these institutions that don't really exist other places, to be honest, not in that way. And so it really enables something, I think, 5 years from now, which is very special in this environment. So the hope is that this gBETA and gener8tor can kind of work in this environment to take advantage of all that. So.
And Dan, I have to imagine in 5 years, Rochester is going to look quite a bit different.
Yeah, it will. Frank is alluding to Destination Medical Center, significant public-private partnership between the state of Minnesota and Rochester to add infrastructure to make the city more welcoming and more capable of growth in the area of innovation. The first building is going up right now. There's lots of planning going on in Rochester and seeking certain companies to come in and establish a beachhead and be a part of the innovation that goes on with Mayo Clinic and such. So there's going to be a lot of change going on down in southeast Minnesota, and it's all good. The momentum is great. The momentum we've built over the last 4 or 5 years, when in Rochester there wasn't a business accelerator like there is today. There's probably 3 or 4 of them in town now that exist. There wasn't this employee entrepreneurship program. There wasn't the seed money that we have to the level that we have at Mayo Clinic to seed interesting technologies. But my colleagues are right here. We've got, in southeast Minnesota, we've got great healthcare expertise. We've got great med tech expertise up here in the Twin Cities. Marrying those together and building in the next 5 years is one of the key things we're looking to do.
Yeah, I'll say, like, if you haven't been to Rochester recently, you really need to get down there and see both the developments that are happening, but the things that have already been built up, like the accelerator referenced. I think I saw Xavier around here.
Xavier's
yeah.
here, yep, there he is.
If you haven't met him or you haven't met Dan, do and get down there. It's an easy drive, and we now have a second cluster in Minnesota of healthcare innovation, which only makes the state stronger. And 5 years ago, it was not there. The community has done an amazing job rallying around it, building it up, and making a reason to say, yeah, you need to be in the Twin Cities and you need to be in Rochester. Anyway, get off my soapbox for a moment there.
I agree.
Yeah.
Well stated.
They do good work. All right. Well, 2 more questions I want to ask you guys because I want to end on a little bit more lighthearted note, but kind of second to last. And I want to ask, in the work you guys have been doing, what's the way all of us can best engage with what the U of M is doing or what Focus Start or Boston or what Mayo's doing in order to bring value to your work, but also to better unlock value that you guys can provide into this community? And we'll start in reverse.
Yeah, from Mayo Clinic's standpoint, we're an open door. We're completely transparent on the ideas that we have and the technologies and the pipelines we have across a variety of medically related specialty areas, whether diagnostic, therapeutics, med tech, IT, healthcare IT. They're there. We have pipelines on each one of them. We can show what stage they're at. If there are people that are interested in either adding to their portfolio or they got the fire in the belly to try and start something based upon a Mayo technology, we've got nothing to hide. We're willing to. Collaborating with Mayo Clinic is, we're a big organization. The University of Minnesota is a big organization. We're always looking for ways to smooth it out and make it fruitful for both sides. And I think we do a pretty good job of it. We keep the lawyers happy. We keep them out of our way when we're trying to do these deals. But I think just the willingness to collaborate and we're happy to talk to people where their interests may lie.
So reach out.
Reach out, absolutely.
Yeah. Mayo emails, if you don't know, reverse the names, last name first. Always easy way to track them down.
Last name dot first name at mayo.edu.
Yep. All right. Dave.
Sure. I think 2 things come to mind. The first one is just more Boston Scientific centric, and the second one is more, I think, global. So, from my perspective, I mean, I look around here, there's some faces here that I've known for a while and new faces, but there's just an incredible amount of talent, I'm sure, in this room and beyond. And what I would say is that just to encourage people to think about, what are the new ways that we can essentially take the ideas that we have and turn them into something practical that actually is going to get out there and help people. And I think everybody does that within their own organizations, but how can we, kind of reach across to partners to do that in new ways? And what I would say is that while a lot of folks might get up here and say, something is too early, et cetera, we tend to take the opposite approach. We're really interested in getting involved early on new ideas because we think that we bring the right mindset in order to nurture those and actually move it forward. The second thing I would just say is really more gBETA, generator centric. This really works because we have a very robust set of mentors across all of these organizations, but beyond. And if you're interested in being involved and really helping to mentor these cohorts that are coming through here, I think just reach out to the Generator team, because I think there's a lot of opportunity to really help out with that. So,
Thank you. James, Focus Start is kind of a unique business model, so how might...
Yeah, our business model isn't really set up for incoming inquiries, although we're in hopefully the final stages of negotiating with an inventor now to bring on board their technology and manufacture and actually commercialize it. But I thought of it in terms of myself as an entrepreneur thinking about it. And I think one of the things, it's a cliche, but it's true, that if you are starting a company and you've got something that you're passionate about, don't let people discourage you. Be relentless about it. I heard lots of people tell me that what we were doing early on in my first company wasn't going to work out, and they were probably right, except for I was too stubborn to listen. And the next thing I would think of is when you are thinking about solving your problem, if you've got the aha moment, you've got the thing that's going to solve a particular issue, make sure you understand how the market perceives that problem. Because if those aren't in alignment, you may not have the product you think you have. And that's an important lesson that we relearn all the time, that it looks amazing, everything about this checks out, except for no one cares. And it's a humbling experience, but it happens constantly. The last thing is just be open to innovation everywhere. I had a kind of a pivotal discussion with a guy after we sold our first company, and he asked me if I was an inventor. And I had to think about it. I said, not really. He said, well, there are people who wake up every day and their entire passion is making something new, innovating in an area. If your skill set is identifying the opportunity and bringing it to market, do that, which is kind of how I ended up where I am. And I think along the value chain, you can bring your skill set, as Dave said, and you can make something really special, but you've got to be open to maybe changing the way you look at it just a little bit.
Very good. Russ?
Yeah, so what makes the University of Minnesota great is what also makes it probably a bit of a challenge to get into. The diversity of the research here is, we're one of the few institutions in the United States that has such a diverse set of colleges and organizations inside this institution. And but really when it kind of, and I guess putting a plug in for our group, it really kind of all comes together at the tech transfer part of the University of Minnesota. We manage all the inventions that come in from the vast array of research here at the university. So if you're looking for an idea, an invention, even if you're looking for access to a research lab, if you're looking for access to a piece of equipment, we're a good place to start. Now, an exception or an augment to that, if you're in the medical device, which I know a number of you here are, we got Dr. Art Erdman and the Medical Devices Center. It's one of the best medical devices organizations in the world, and the work they do in helping foster education and entrepreneurialism and helping companies in medical devices it's just phenomenal, and they're doing it across the globe. It's not just here in the Twin Cities. So yeah, I guess if you're looking for a place to kind of find your way in, I think our organization, the Tech Transfer Office here at the university, is probably a good place to start.
Thank you. All right, so last question, promised to be a little bit more lighthearted. I want to ask you, what's the worst piece of advice you've ever got? And I'll tell you mine. It was, you can't go wrong buying GE stock. And that was recently proven epically wrong. So it happens. Any last lighthearted thoughts? I won't put you on the spot for that one, but horrible advice for our attendees.
Yeah, since I'm on the end here, I'll start. If I knew back when worked on my first two startups, if I knew then what I know now, I would have done things a lot different. I got a lot of advice, and it's hard to pick out any one of them that was really bad. And the one piece of bad advice that really isn't funny, we had, we were trying to figure out how much we were going to go out and raise, and we had some help doing that, and they convinced us that we should go out and try to raise it all at one time. And in retrospect, we should have chunked it out a little bit. So, I look at that now and said, geez, that was a dumb decision. But, we took their advice and we went down that path, and we ended up getting most of it. But boy, did we work hard at doing that. And we gave away a lot of the store. A lot of the equity of the company went out the door in order to make that happen. But we got the money.
And you learned. And you learned.
I've got a really not serious one, I guess, but I'll start with piggybacking on Russ again. You get a lot of advice when you're an entrepreneur. I tended to ignore most of it, which wasn't the right tact either, but I think it's probably better. I mean, you're not in that position unless you already have a pretty good willpower and and a drive. So I ignored a lot of good and bad advice. And then the worst advice I ever got was that I can impress my now wife by doing the longest keg stand at my house party, senior house. So, yeah. I won, but she wasn't impressed.
Life lessons. Dave or
Is that
Dan?
on your resume, by the way, or not?
I have to say the worst bit of advice I had was, prior to having a career in med tech, I actually worked in the oil industry. And so I worked in the Chicago area for a company called Amoco, which many people may not remember because it doesn't exist anymore. And the advice I got was, and I decided I was going to leave Amoco and come to Minnesota to get my PhD here at University of Minnesota in chemical engineering. And the advice I got was that was the dumbest idea that they had ever heard, that I had a bright career ahead of myself at Amoco, working in the refinery, et cetera, and I should stay. And I did not listen to that. Very happy.
That was very good advice not to take. We appreciate it. Dan?
So this is nothing earth-shattering. That's not going to measure up to what these other three gentlemen said, but I think this is a general piece of advice for anybody that is working in the world of tech transfer, and that is to be straight up with your inventors, and that and understand that everybody who's got an idea is generally in love with their idea, and to just not pacify them and be straight up with them if in fact the research and the facts show that either the market's not ready or the technology may not be ready. And sometimes, their baby is ugly, and you kind of have to delicately say, I know you put a lot of work and effort into that baby, but it needs to grow up a little bit before it's going to shine. So we just need to be able to be straight up with folks like that. And when you're not, it harms both sides. So.
Yeah, a mentor of mine once said, a lot of puppies grow up to be dogs. So.
There you go. Exactly. Cute puppies.
Well said, well said.
Dogs, right. I like that.
I like finishing on that and things like this because so many of you are working on things that are truly hard, truly impactful, and you're going to have a lot of bumps and a lot of failures along the way. And, there's the old saying, right, you either win or you learn something. And I hope we all learned a little bit something today. Let's thank our panelists for sharing their knowledge. Thank you all.